Long haulers, it's a term we know nothing about or knew nothing about a year ago, but COVID changed that. Patients who survived the virus but struggle with lingering symptoms months after infection. Here to talk about what we know now, Dr. Dilpreet Kaur, a pulmonary and critical care specialist with Windham Hospital. Thanks so much for being here with us.
Thank you for having me.
Okay, so several months ago, we first heard about long haulers. How are they doing on a whole?
Yeah, I continue to see long haulers. They have been lasting symptoms for like 6 months to 12 months. I've been surprised. Some of them improve even though they're older in age, but a lot of them who are younger and active at baseline continue to have the respiratory symptoms. They have asthma, which they did not have before, and it has been prolonging for months and months.
What kind of treatments have proven to be effective at the COVID Recovery Center?
So we make sure that we do not have patients with stroke, heart failure, or underlying diagnoses that have not been detected recovery center. Once they have ruled out significant life-threatening diseases, we treat them with steroids like inhalers for airway inflammation, nose sprays for loss of taste and smell. Physical therapy has been really helping for patients with weakness, loss of balance.
Has anything surprised you about their progress? Obviously, you talked about some of your older patients. Anything else?
I have seen patients coming off oxygen, patients who were on, a lot of oxygen after hospitalization, and I did not expect them to improve. I have seen them improve. On the other hand, I have seen patients, not being able to climb stairs, having loss of taste and smell much longer than I expected in spite of treatment. What has surprised me otherwise is that they get recurrent symptoms. Even though they improve, it can get worse and recur.
How have summer weather conditions, when we're talking about air quality, specifically when we talk about some of these western wildfires, how has that some of our long haulers?
The long haulers have something called reactive airway disease, especially from pulmonary viewpoint. Any kind of chemicals or poor air quality can make the reactive airway disease worse. As I was talking before, the recurrence of symptoms, I think, is happening due to the poor air quality. So the pollution, in addition to the heat and humidity, a lot of them have been, staying indoors or coming back to the office for more treatment. It's not helped them at all.
Well, we appreciate you joining us today and talking to us all about this.
Thank you. Thank you.